Hey everyone, welcome to another edition of EDTalks. I'm Ed, your host, and more important than that is our guest, Praveen Chopra. Praveen, welcome to EDTalks.
Pleasure. Nice to meet you.
Yeah, you're one of the most interesting people in healthcare, certainly in the CDO, CIO ranks. Everyone's interesting. Nobody take offense. But given your background, and we're going to dive into it in a little bit, so I don't want to steal your thunder. Tell us about yourself first, and then we'll go into that.
Yeah, thanks, Ed. So as you said, I serve as the Chief Digital and Information Officer, but I've been fortunate to have seen the transformation in three industries: the manufacturing, and then retail, and then in healthcare. And I now am at Emplify Health, which came about with the merger of two really community-rooted health system, Gunderson Health and Banner Health, and we call it Amplify Health because we like to amplify empathy. And
Love
that
it.
is the entire story behind Amplify Health. So it's a pleasure, and I'm having a lot of fun.
Yeah, so as you mentioned, you're really now in three industries. I mean, you're deep in healthcare now because you've been doing it for quite some time at places like Thomas Jefferson before, Children's in Atlanta, if I recall correctly. And there, that was sort of a transitionary role, right? Because there you were CIO and head of supply chain. So I think that was in recognition of your previous work at like Home Depot and maybe at Accenture, where you delved more into sort of the retail and the manufacturing. Did I get that
Yeah.
right?
Yes,
All right.
you got it
So
right.
I know that specifically when you came at Thomas Jefferson, but you've been doing it ever since, you brought in a different mindset. That's why I said, a unique guest. You brought in all this experience from outside of healthcare and this retail manufacturing. I know it still drives you today. Tell us a little bit about that. Like what sort of things what surprised you in healthcare? And then what sort of things did you bring from that retail and manufacturing background into your scope?
Yeah. So I think it's a combination of what I learned both in uh, manufacturing and retail, and then also what I learned about healthcare. So one of the fundamental thing about, I think, retail and manufacturing is it's a lot about transaction. It's very transactional business. And we talk about it, and that area is like, you look at manufacturing, your customer is more like it's kind of a B2B. Your customers are other businesses. And retail, it's a lot about the direct to consumer play. But still, at the end of the day, we look at customer and we try to understand all their behaviors. But at the end of the day, it's all about transactions. When I came to healthcare, it is all about relations. I think it's more about, do you know person as a home? So it's a lot of empathy and emotions and doing the right thing. In retail, it was a lot about efficiency and scalability, and healthcare is all about uh, total care coordination. And sometimes it's not as efficient. We talk about more about effectiveness versus efficiency. Learned both the things, and I think both the industries, actually all three industries, had to learn from each other. So to me, I'm fortunate. I was happy to be part of three major transitions, and you bring something along. Hopefully, you learn from your bad habits and you don't repeat them. And then good things you learn and you bring that within healthcare. And I was fortunate to be able to work with great leaders who embraced the good things that were about retail. And I think long before COVID, we were using retailization of healthcare. And I think that is how I think we started bringing a lot of principles.
No, that's good. It's super interesting. Is there one thing in particular that
Yes.
you brought over with you from retail and manufacturing that,
Yes, actually, there are two things. If you think about the good thing about healthcare is trust. People have to really trust you as an individual, the caregiver, the people you interact with. In retail manufacturing, you trust a brand, but not a person. But in healthcare, you actually build the trust around your care team and the person who's taking care of the entire thing. In medical home, clinician that you're working with. What healthcare was designed for people to come to us. Remember, it's not like I want to, I have to.
yeah,
Most of the time, healthcare is people say, it's sick care, is that right? I don't want to go there until I'll try and avoid every single time. I don't want to go. Even if I'm a little bit sick, I'll figure something out. But I will only call because I have to. I think what we learned from retail is that I want to, is that right? I want to use. So you think about, I want to use Amazon because it's so convenient. So I start thinking about what is the difference between I have to versus I want to. And I think two things became very clear, which I think retail was really good at, is convenience. A convenience, you can define convenience so many different ways. It can be speed, it can be availability, it's access, the many ways of doing that. And the second thing, retail was really good at affordability. So retail was really thinking about, for the longest time, it was keeping the prices down. And we talk within healthcare about AAA. Remember, we talk about, well, let's make sure that the quality is there, and we make sure we are talking about access and experience, and we're talking about affordability, but we really didn't focus a lot about that. So I say we can do it. If we learn all the three things together, how can we become convenient and how do we become affordable? And I would just say, I think before you hear about like COVID, like healthcare had to keep their door open and no one was coming out. And I will tell you, when I was at Jefferson, we started the telehealth program even before COVID. We scaled it up. It was a really good partnership. And we think about, at some point it became telehealth, but at that time it changed more into virtual care. And at some point I said, it's not really telehealth or virtual care, it's just care. Is that right? And this is retail lingo. It's a different channel. You have different channels of approaching. So I said, well, this technology-driven channel is one of the many ways in which we can connect with people. And then convenience is that they don't even have to drive. They had a surgery, and after the surgery, they have to do the post-surgical visit. Well, you take a day off, you have to find the daycare, then you have to pay $50 in parking. Can we just get rid of the entire thing? Because the entire visit takes like 5 minutes. We started experimenting that. I think we scaled that up for our employees, then we scaled it up in the regional level. And I think probably 2-3 years before even COVID happened, we were already seeing like 10,000 patients in a year.
Yeah.
And not only that, it became a convenient, but what we saw that the insurance premium, because we were self-insured, it went down by like a percentage point just by experimenting in a very meaningful way. So that's like one example of when we saw that, let's push the limit, let's see what we can do. And I call it the people process technology. We looked at the opportunity. What do we need to do from people? What do we need to do for process? And what do we need for technology? That's a very good way of doing it. The other thing we did was, well, we call it the urgent care, and we call it the kind of extension of the ED, but we did not change the hours. I said, can we just extend the urgent care to like 11 p.m. and 12 p.m. and let's look at the schedules differently? That changed the game, and we started opening things on the weekend. So every single time I went from one health system to another health system, we started doing it, and like here, brought.
Yeah.
Rural health, and we are trying to push the kind of limit on all those aspects.
For me, this is awesome. My head's exploding already. I know the audience is getting a lot of good ideas. I think some organizations are doing a little bit of what you talked about, but you just, gave like the whole suite of different things you could do. And I love, just to summarize, in terms of what you brought to retail, was this whole concept of affordability and convenience. And then you gave great examples on how you did that. And I loved what you talked about too with the brand, right? We work so hard on the brand in the B2B or even the B2C, where in retail, it's really the brand. You're building trust in a brand, but in healthcare, we have to build it, each provider, each clinician, each member at a time. And those are really good. Praveen, thank you so much for being part of EDTalks. This has been super, super insightful.